Former Buffalo Bill Kevin Everett will never play football again, but the fact that he's able to even walk is nothing short of a miracle.
Yes, I was conscious of everything. I knew I was paralyzed.
He credits his recovery to a cooling therapy.
I'm very thankful that they used the treatment on me, because I really do believe that it played a major part in my recovery. And I came close to death that day.
Every step is precious for Kevin now.
Robert Hill may be a medical pioneer. A few weeks ago, he went to university hospitals for multiple bypass surgery, but his heart stopped before the operation began.
I had no idea it was that bad.
Dr. Ari Blitz used this device, the Thermoguard catheter, to cool Robert's blood to prevent him from getting brain damage.
So it kind of puts you in a suspended animation for a while your body healed itself.
Robert is still recovering, but grateful to a device that saved his life.
It's a life preserver for your heart.
Thomas Benton survived 2 heart attacks and lung cancer, but this year he thought his time had finally run out.
I was looking at the end of my life. It was over.
Thomas's wife recalls the moments after it happened.
He said the vest went off. At first that didn't register. What does that mean? The vest went off. Then it finally did. Oh, he was dead. He's alive.
The vest did what it was programmed to do, and he went into a potentially lethal rhythm disturbance, and the vest shocked him. Saved his life.
More than a month later, Thomas is recovering from a successful heart transplant and celebrating a birthday he didn't think he'd have.
A doctor's visit like this may be an inconvenience for some people, but for 65-year-old Dale St. Louis, it's a necessary part of life.
I don't remember much other than waking up upside down in the truck.
St. Louis's heart attack weakened his heart muscle, but he says without Life Vest, he wouldn't be here.
83-year-old Luis Valenzuela is surrounded by his family. He wouldn't be with them today if it weren't for a wearable defibrillator.
He had that massive heart attack on the 29th, and it basically saved his life.
And it's already saved 100 others across the country.
And well, we have him here. That's what really counts now.
A family thankful to be together with the help of a vest.
Hey, thanks for saving my life, John. Just doing a job.
It's a meet and greet that meant the world to David Crow. It started last week as he mowed the lawn.
And I was almost done doing it, and I have no recollection of what happened, but apparently I had a heart attack.
So almost 50% of the people we encounter now are getting pulses back as a result of this auto pulse and defibrillator combination.
That's up from an 8% save rate since last August. After about 2.5 minutes on the machine, David was breathing on his own. In the hospital, he told the fire chief he had to meet the people that brought him back.
I want to just come and say, look in each guy's face, each guy's eye, and just shake their hand and say, thank God and thank you for saving me.
A local doctor was in exactly the right place at the right time when he suffered a massive heart attack.
He felt crushing chest pain and was trying to get to Memorial Hermann's emergency room, the hospital where he works. He was walking in a hallway with his daughter when he passed out and tumbled to the floor.
Somebody help, I need somebody right now, somebody. And so then all these people started coming.
I turned and I saw Dr. Daly on the ground.
Medical workers immediately started CPR. Then more perfect timing.
One of the EMS rigs that was available in the parking lot happened to have an auto pulse device that creates pressure and essentially does automated CPR in some ways more efficiently than even we can do as humans.
I think we all have a purpose in our lives, and whether mine has not been met yet or not, I can't really say. Now Sophie admits she'll always be a daddy's girl.
Like, I love him so much.
Melissa Wilson, Fox 26 News.
She loves her dad, and she gets to have him for a lot longer.
That's right.
It's a wonderful story.
Good news for their family.
Thank you very much.
You're welcome.
Healthy and glad to be alive. Wayne Laporte got to look his rescuers in the eye.
Really appreciate everything y'all did. I wouldn't be standing here if you hadn't done that.
2 months ago, Laporte collapsed in the shower, not breathing and with no pulse.
One person is setting the machine underneath him, one's ventilating, another one's hooking the patches on and seeing if we have any activity in heart condition and what situation we're actually in.
I'm standing here right now breathing, and that's a good thing.
Watching for himself now, how his own life was saved.
Without CPR, the chance of survival drops 10% for every minute.
A year ago, Robert Lynch had a heart attack.
I was out throwing cement blocks in a dumpster one day, and somebody parked a semi on my chest.
Lynch knew what was happening to him. He's a retired heart surgeon. But what he didn't know was how quickly he would get treatment.
I think I set the record for him the time I hit the door to the cath lab, which was 20 minutes.
A 12-lead electrocardiogram. It sends detailed information on a patient's heart to doctors waiting in the emergency room.
From the time 911 is called until we get them to the hospital, if we can shave even 10 minutes off of that time, we're doing the patient a world of good.
A sentiment Robert Lynch appreciates.
And I have absolutely normal cardiac function today. And all I can do is say, Mike, thanks.
A device saving doctors time and patients' hearts.
Hi, I'm Scott Pribble, and I'm the Public Information Officer of the Arvada Fire Department. One night in late July, we had a thunderstorm come through about 10 o'clock at night, and from 10 o'clock at night until 6 o'clock the next morning, we answered over almost 200 emergency phone calls related to this storm, and sent the crews out on just short of 100 emergency calls, and the CAD system was fantastic in helping the dispatchers manage that situation and get us through that successfully.
It was January 14th, 2008. Virgil Throneberry and his wife were at the Plano Senior Center for their daily workout when his life nearly ended.
He had probably been on the exercise bike maybe 2 or 3 minutes, and in the mirror I saw him fall off.
Virgil suffered a massive heart attack and needed help fast.
So they just came running down the hall and said, hey, there's a guy down, on the floor. It's collapsed.
Falling back on years of required CPR and AED training, Pam Perry and one of her co-workers stepped in until help could arrive.
She was doing the breathing for him. I was doing the compressions.
They told us that Virgil was without a pulse for 30 minutes. In my opinion, without those two ladies, the paramedics would have not been of help.
Virgil doesn't have very many memories of the heart attack or the days after, but he knows it was a close call.
My son and him came over, and excuse me, he said, Daddy, you was dead.
And just like that, your life is totally turned upside down. And it could have been turned upside down even more.
Just to know that you had that little bit of input.
I appreciate it very much. You don't know how much.
To help him out, that's amazing.
When somebody has a sudden cardiac arrest, the odds of survival diminish with every minute that passes. A boy in Franklin Township knows that recently time and technology worked in his favor. The first minute of class, the last Monday of the school year, 15-year-old Austin collapsed. He was blue and had no pulse.
He was not with us at all.
I said, run and get the AED now.
At the front of the school, she reached the AED box, grabbed it, and sprinted all the way back.
50 seconds or so, she was right back here with the AED.
It tells you everything to do, thank goodness.
Attach defib pads to patient's bare chest.
How many times did you shock me?
3 times.
Ouch.
I couldn't believe it, because you don't expect a 15-year-old to drop dead.
I can just remember saying that and just saying, it is not, he cannot go.
Austin is going to be a freshman because of them.
After 31 years, you gave me the experience that I don't think any principal ever would want to have again, but I'm glad that it all turned out great for you.
Austin remembers only waking up at the hospital, but is grateful that when he got ill, he was at school.
They saved my life.
He's a happy boy tonight.
Tonight, we have a great save to tell you about.
It didn't happen on a baseball diamond. Instead, it happened last Tuesday on the football field at Wayzata High School.
I remember one police officer coming over to me saying, you guys were awesome. You saved a life. I went, oh my gosh, that was great.
Ted Okerstrom visited his pals and coaches today. The 16-year-old looked fine, but
something went wrong.
Teddy went down. He just fell. I mean, he was down.
And everything else went right, except for Ted Okerstrom's heart.
About within 3 seconds, I looked down at Teddy, and he went from quick breaths to no breath.
Dee Schrader is the secretary in the athletic office. She's also an EMT. She grabbed one of the school's AEDs, automated external defibrillators, and hustled to the field. She handed it off to one of the boys.
He grabbed it and ran. And like you probably have heard, little did I know I had handed it to the fastest runner in Wayzata High School.
Meanwhile, Ted's coach was doing CPR and giving him the pep talk of his life.
Let's go, buddy. We're going to make it. This ain't it. We got people coming. Let's go. Let's keep fighting. Let's keep fighting. Just very much coaching type stuff.
Basically, once we turned that AED on, we listened to that and let it run the show.
And it worked perfectly.
The defibrillator saved Ted, and he knows it.
It can save your life. It's a great machine. I want to stay involved with Wayzata football because it's a big part of my life.
For a kid who loves football, that's hard to take.
Dennis says schools aren't required to have defibrillators, but that story shows why it's a good idea.
Well, she was having fun in gym class when she suddenly collapsed.
Yeah, 2 Boston teachers and EMTs rushed to this cute 6-year-old Olivia Quigley's side and saved her. Those EMTs and teachers were honored by the American Heart Association. Olivia was in seemingly perfect health at the time. Firefighters and EMTs arrived soon after, using a defibrillator to shock her heart. Olivia's heartbeat returned moments after rescuers used that defibrillator.
It makes me feel all happy and we feel all happy.